Vice-Chancellor at UCT, Professor Mamokgethi Phakeng, says the death of the Dean of Health Sciences, Professor Bongani Mayosi, presents an opportunity for the institution to reflect on many staffers who suffer mental illnesses. Phakeng says Mayosi and many academics have been badly affected by the 2015 Fees Must Fall protests. Mayosi's family has issued a statement saying he committed suicide on Friday. Phakeng told a media briefing that the 51-year-old cardiology professor had taken a 3-month leave early this year for depression. She says the 2-week occupation of Mayosi's faculty by the Fees Must Fall students in 2016 hit him really hard.
It's a very difficult time for us as a university, because Professor Mayosi was not just a staff member at UCT. Professor Mayosi was a leader in so many ways. He was a scholar, a highly respected scholar in scholarly fields. We have a ranking system in this country, and he was A-rated. And A-rated means someone is a world leader. So he wasn't just a leader at UCT in the country, in the continent, but in the world, in cardiology. And that he achieved before he even assumed a management position as dean. And so he's been one of our top people. So losing him is a huge blow. It's a huge blow for a university because of his scientific standing. I'm sure you'll have read that he's won every award that there is. Professor Mayosi has won it. But we're not just losing a scholar at UCT. We're losing someone whose voice was very important.
All right, for more insight on suicide and depression in light of the dean's suicide, let's try again and welcome Dr. Khanyisile Nene, who is a clinical psychologist all the way in our Durban studios. Doctor, a very good afternoon to you once again. Can you hear me this time?
Yes, Pasha.
All right. All right, Doctor. Look, thank you so much for joining us again. Look, let's first understand what actually depression is, because I think we're still very unsure about the actual symptoms and how this disease actually manifests itself. Go ahead, Doctor.
Okay, so depression is a mood disorder as it's, describes itself. It is a mood disorder which is characterized by significant changes in one's emotions, in one's moods, and which affects one's quality of life. It affects their social life, it affects their occupational functioning, it affects relationships. Yes, and some of the important symptoms to note, or which can help us in identifying if a family member or anybody is experiencing depression. A number of them. I think the most significant one that we look for includes a significant change in your mood, which has to be persistent for over a period of 2 weeks. It must also, we can also see one experiencing self-esteem issues. There can be also significant changes in one's weight, in their sleeping patterns, and some of them, they may even become socially withdrawn. And in other cases, it is accompanied by anxiety, self-esteem, like I have mentioned. And in other cases, depending on the severity, it can be accompanied by feelings of hopelessness and helplessness. And I think that's where it then leads or goes to the more severe stages, where it can now be accompanied by a suicide, and that is where we then find the issues or problems with suicidality.
And then, Doc, look, just how rife is suicide and depression, especially among professionals, and what makes it so unknown or unspoken about? We understand that the dean had actually, he took the Fees Must Fall protest very heavy. They weighed very heavily upon him. He even went on leave for about 3 weeks, but this all didn't help.
Well, I think depression is known to be the second leading cause of death and disability. I think even the World Health Organization does recognize it as such a significant mental health problem that is affecting not just South Africa, but it affects every one of us globally. And it is quite a serious concern that it needs to be addressed. And I think with Prof's situation, like he had taken that, he knew what he was experiencing. Yes. Family was aware what he was experiencing. He acknowledged and he took that leave to go and help himself. So in other cases, yes, we may be able to understand ourselves or treat ourselves, but other cases, it's just a hopeless and helpless situation, which I think support is quite crucial at that moment. And so it really needs to be paid attention to.
Absolutely. Doctor, as you speak of families, I wanted to ask now, how do we as families and friends or even colleagues try and assist without being perceived as nosy?
Absolutely. I think it's quite it's often a challenge, for both individuals who are struggling with mental illness such as depression, come forward. But beyond that, it's also difficult for families and friends to even, come over or come through to assess, because like you're saying, they don't want to seem to be nosy, okay? And part of this is related to the stigma that we are all aware of, that, mental illness is a taboo topic, and so given, the myths and the stereotypes that we have in society, then it's going to be difficult for one to address a victim of depression or a person suffering from depression, to say, this is the help you need, or how can we help you? And often people go on a lonely journey, experiencing this all alone. So as family and friends, I think then it is, our responsibility, no matter how lonely the person wants to be, they are not at their right state. So it is our responsibility to ensure that we protect them, we care for them, we're there to support them. Because in some cases, it could be that they are feeling all alone and they don't even want you to be anywhere closer, because they already know the stigma attached to it. Absolutely. So we need to break the stigma by going forward, go and be present, be involved, even if they don't want you to be there, because the support, knowing that you care, it's like a seed that you are sowing into this person's life. 2 weeks later, they would know, what, somebody had tried to reach out for me, at that stage or point of hopelessness where they're trying, or suicide is the only option. Yeah. If only we had tried and reached out, even if they are not ready, but at some point they will be ready. So I think we need to just don't stop, trying and reaching out for these people, because it is one of the misfortunes of depression, that people just don't want anything to do with other people. They dissociate themselves, they withdraw themselves from society, from families, and that is just depression. So we need to understand that is not because they don't want to be helped, or they being so moody, we don't know what to do with them. We Absolutely. Need to acknowledge and respect that this is the severity of depression, and we need to be there.
Yeah, they mustn't suffer silently. Now, Doctor, do you think there's enough information about self-help tips or even places that you can go if you feel that your load is just way too much? We know that some people internalize their issues. So how do you even begin to help someone who doesn't even think they need help?
That's very true. That's very true, Alicia. Most people don't know where to go. Most people don't know that there is help out there. And I think there are studies that show or that look into the barriers of people, why people don't reach out. And some of them, it's because they think that they can handle depression themselves. Some of them, they do not understand the severity of it. Some of them, they just don't even know that it's so serious, or it can be treated. So they feel that, what, it's not important, nobody's going to listen, or I will not get the help that I need. Number one, we do have the South African Depression and Anxiety Group, which I think is is nationally known, you know. It provides services for people with depression and anxiety. We do have public hospitals where individuals experiencing or maybe suffering, but they do not know that it is depression, where they can go and consult with psychologists available free of charge. And there are psychologists in private practices, even though, of course, majority of the people that would desperately need to access psychological or mental health cannot afford it. But there is help in public hospital, even though it is very, very under-resourced. And I think it is something also that the governments need to start paying attention to, because we often find that mental health is often something that is not taken so serious until somebody's life is lost. Then we start opening our eyes, that we start trying to address it, but it's too late. How many people, except a prof who has recently killed himself or whom we've lost through depression, how many other people's lives have been lost, you know, and families don't know what to do. Families don't know what to do. The people suffering themselves don't know what to do or where to go. I think mental health awareness needs to be something that we need to prioritize on as a nation, not just as healthcare professionals, but it's something that the country as a whole needs to, in order for us to break the stigmas associated with depression and mental health as a whole.
You know, Doctor, when you speak of that, I was actually going to ask if we should indeed be having more open discussions about these issues and how they exactly affect our societies. I mean, I know that mental health, particularly in the black culture, is something that is frowned upon. You don't you can't get the help that you need the first time around because people are still surmising whether you actually are suffering from depression, or some of them totally disregard depression as an illness that could kill you.
Absolutely. I think that is very, very common. I think with cultural, you know, sometimes I think we need to acknowledge that, yes, in other cases, symptoms of depression may be similar to those that we see in other cultural illnesses, you know, but with the proper professional assessment or evaluation that one can get, or, you know, you can be able to ascertain whether this is a real clinical depression or it's just something that we can treat, you know, treat via a ritual or whatnot. Because, you know, though, yes, we do acknowledge that sometimes it may not be serious depression or it may not be depression. However, symptoms may be there. The symptoms of depression are universal, whether you're in the UK, whether you're in South Africa. So it needs to be evaluated or assessed by a qualified person. And then we can then refer you. If you feel that perhaps it is something that a traditional healer can attend to. I know that in the black communities, you know, who knows how many of us have heard of psychologists until, you know, until maybe you desperately need one or you come across one. But we don't know that there are psychologists who exist. We don't know that mental illness is real. Some of us may even associate some symptoms of depression with other cultural illnesses, not cultural illnesses, but phenomena that we experience. So I really do feel that we need to be educated on the symptoms, on what is really the difference between the two.
Absolutely, get all those opinions. Doctor, we're going to leave it there. Thank you so much for your sound input. That is Dr. Khanyisile Nene, who's a clinical psychologist, talking to us about depression and suicide. This, of course, in light of Professor Mayosi, who took his own life last week, Friday.